there's a lot of difference between a child and adult, and even the children, the first, second standard children are also attending online classes. So, is there a different set of routine or a difference in nutrition for them, which is usually there for them also, so that they do not develop any these kind of issues?
Typically, I'm very happy that you brought in these issues, because I think in our society that issue is been hugely neglected, and I think now the most of the houses or our homes are not designed to have you can say that an area where we could have a very good ergonomic arrangement for kids where they can attend the online classes. And I think for adult and the people who are working in the corporate sector or working from home, I think they are more or less aware about the ergonomics of the desking or the seating solutions. But our kids are not aware of that how they should be doing the online classes, and this subject has been neglected by the teachers and the schools as well, because everybody was thinking that this online classes behavior is a few months job. I think then the online classes would be starting, and what we could foresee is that these online classes for kids are going for long, and now we have to take a serious call on how our kids would be taking the online classes. I think first our teachers and the schools needs to be educated and trained about the needs, how the online classes should be taken. And one thing I would like to bring to highlight here is that now most of the kids are doing online classes on mobile. I think if I say a ballpark number, I think it would be more than 80 to 90% of the kids are taking online classes on the mobile. I think that's a typical no. That's a typical no from a orthopedic point of view, because you could not have an ergonomic positions or the neutral position of the body with the mobile. So you can say that this position would be worse than using what we could say that most of the corporate world is using laptop. You fear a laptop use. I think this position of using mobile while learning is a worst position that we could have. I think our kids needs to be shifted to a desktops for a learning environment, and if not, you can say that you should have a laptop with a proper desking and seating arrangement that I have already narrated. The precautions that you should take care of, that while sitting, your posture should be in a 90-degree. Your thigh should be parallel to the floor. While you are working on a keyboard or mouse, your arm should be rested on an armrest, and that should be parallel to the floor. And while you are using the keyboards, normally what happens that we put the keyboards on the table, and typically our wrist get the friction from the edge of the table, whether that is in a sharp edge or a rounded edge. I think that's the worst position of the wrist that could have. That typically leads to the wrist issues and the problem with the tendons and the nerve, that what we typically is a carpal tunnel syndrome, that what we typically get with that position. And for the kids, the height of the table and the chair needs to be adjusted, so that you might need a docking kind of a thing, or you need something, tables, you can say that overhead tables you have to use. So that needs to be that needs an individual attentions, because the typical desk heights or the seating heights, these are made with the consideration of adult data, or the you can say that they are made for the adult, and we don't have you can say that particular kids age table or a seating solution available in the market. So what we try to get is a modular seating height or a modularity in the desking solution. That is a need for our kids if that online behavior is going for longer term.